today from Dr. Peter Lichtenberg, who is the director of the Institute of Gerontology and the Merle Palmer Skillman Institute. He's a distinguished professor at Wayne State. We also have Dr. Tam Perry, who is an associate professor in the School of Social Work at Wayne State University and a faculty affiliate at the Institute of Gerontology at Wayne State, and is also a co-leader of the Community Liaison Recruitment Corps. And then we will hear from Ms. Vanessa Roe, I hope, or hopefully she'll pronounce that better than I will. Please forgive me for that. And she's the Community Outreach Specialist for the Healthier Black Elders Center. And then we have Mr. Henry Swift, who is a member of the Community Advisory Board and also a member of the Healthier Black Elders Center. So at this point, I'm going to turn it over to Tam Perry, and she's going to lead most of the rest of our discussion, and then we'll leave plenty of time today for Q&A.
So hi, everyone. Our director, Peter Lichtenberg, who is also, for anyone, does anyone on this call go to the Gerontological Society of America meetings? So I'm hoping so. I do. Anyway, he's the incoming president of GSA. So you may see him on a national stage soon. But anyway, Peter couldn't be with us today, but he tape recorded an intro. So, oh, here's our agenda, sorry. So we're gonna first hear from his video. And then we actually wanted to put Henry front and center second. And then we're gonna go over our program principles, and then we're gonna turn it back over to sort of a discussion that we're happy to be in the background for, that Robert can sort of lead your group through. So first of all, thank you so much on behalf of MCUAAR. MCUAAR is something that I think when you hear our passion, you'll hear how committed we are to this approach in research. So I guess we can just play Peter's video, and everyone else can mute maybe during the video.
Brittany, it doesn't sound like there's any sound on our end.
That was because I was muted, but we're good now.
Center Participant Resource Pool, partnering with the Community on Aging and Health Research. You know, the Michigan Center for Urban African American Aging Research, the MCUAAR, has had a variety of leaders in its community core that have been responsible for the great success of the Healthier Black Elders Center and of the participant registry. Pictured here in the middle, Dr. Olivia Washington. To her left, or excuse me, to my right, Dr. Letha Chadiha. Right underneath that is Dr. Carmen Green. These were the faculty leaders for the participant registry, but we also had Pat Rencher, Karen Daniels, and Winter Wyrick as some of the community outreach specialists in the early days. We recognize Diane Brown and Daphne Ned, who really started the Healthier Black Elders Center. So the MCUAAR's mission is twofold: to promote high quality scholarly research and community-based interventions focused on health disparities and health promotion among older racial and ethnic minorities, but also to provide health education that is relevant to the needs of older minority community members in Detroit, and provide community-based training for young minority health science scholars and to partner with the older adult community in new and different ways. Some of our accomplishments before we jump into how we've done things: we've had more than 70 scientists complete the program. 70% of them were African American junior faculty. 2/3 of those are now tenured university professors. We boast provosts and deans, and they've published hundreds of research papers and won nearly 100 grants totaling $60 million in funding. Early on, we had the opportunity in the city of Detroit to actually ask some questions in a randomized sample about health research, people who did and didn't participate. What we found was people probably often didn't participate because they weren't asked. And when they were asked, they had a fairly high rate of participation. This really led us to believe that we could create a research participant registry that would be very much something that the community members would want to engage with. Dr. James Jackson was the principal investigator from the beginning of the MCUAAR in 1997 until his death in 2020. I became the co-director in 1998 and have remained as the co-director at Wayne State since then. And in this last round, we added Michigan State University. As I said, Dr. Diane Brown sort of created with a community advisory board the Healthier Black Elders Center in 1997 to 2002. And when she moved away, I moved the Healthier Black Elders Center into the Institute of Gerontology, where we were able to bring the IOG resources as well as the faculty resources from the grant. And in 2005, we created the resource pool. And look how many people it takes to really do this well. We are so fortunate in this 5-year cycle to have Tam Perry, Jamie Mitchell, Vicki Johnson-Lawrence, Ken Key is not pictured here, be our faculty leadership, and Vanessa Roe, Joanne Smith, and Patricia Watkins. The last two have recently retired. But on the right-hand side, you can see the Institute of Gerontology Outreach and Engagement team, and they really help as well with our participant registry. Letha Chadiha wrote this seminal paper in 2011, and in it, she really kind of lays out the logic model, illustrating the recruitment process. Some of the key resources are Community Advisory Board, older adult volunteers, service agencies, financial sponsors, and our community outreach specialists. One of the lessons that we learned early on was to make Healthier Black Elders Center synonymous with fun and celebration, in addition to giving out health information. And here you can see some pictures of people engaged while they learn. So in addition to those kinds of educational sessions, we're encouraging older African American adults to consider participating in research. This conference was called The Art of Aging Successfully, and the name of that program was intentionally chosen to be inclusive. Anybody can learn how to age successfully. So we have the health reception, Art of Aging Successfully. We no longer have the separate health reception, but we did for many years. We have the Community Advisory Board. We have the Lunch and Learn sessions, our newsletters, resource tables at community events before we went all virtual, COVID, and our participant registry gets follow-up surveys every 18 months, and we stay in touch with them with cards, birthday cards, and greeting cards as well. You can see a couple of our Community Advisory Board members with Vanessa and Tam. The annual health reception, held for about 11 years, really was an event to behold. And in the middle, this gentleman is Sidney Stahl. He was the original program officer from the NIH and the NIA, I should say more specifically, who oversaw the Resource Center for Minority Aging Research, of which the MCUAAR was one of the original members and continues to be. As Sid Stahl came to one of our events and had the best time serving meals. And you can see music, exercise, information. We make this quite a celebration. And the annual Art of Aging successfully. You can see the numbers. We sell out every year. It's just the maximum that the venue space can hold. We always have to turn back. We charge $18. We have to turn back lots of checks. We only charge that much because that helps make sure people come. When people sign up and don't pay even a nominal fee, the show rate is very low. And since we have such a demand, we made that decision. In our Art of Aging Successfully conference, and we will go back to this when we go live again, hopefully in 2022, we have our gallery walk, where artists of all kinds, written pieces, paintings, crafts, show their wares to the audience during the breaks and before the sessions. It's very interactive, very much promoting older adult wellness. Our Community Advisory Board has really been an important part of our growth and development. And as I mentioned, Tam and Jamie in particular, their leadership, and Vanessa has been exceptional. And they've gotten the Community Advisory Board to learn a lot more about the research process. Our Lunch and Learn events are now kind of our key year-round, as well as Art of Aging. And these are set up in different venues around the city or the area, different topics. And our Community Advisory Board helps determine those topics. We have a twice annual layperson's newsletter, and we like to both give general health information, like you see in this article about glaucoma, and also highlight some of our MCUAAR scientists' stress and health among older adults living in Detroit. Here's our database for the participant research pool. No medication trials. We found that the Community Advisory Board did not feel comfortable with that, and there are biomarker trials that go on, or data collection, but no medication trials. Approximately 1,300 active PRP members in the database, and we resurvey and new surveys every year, several hundred. We had, before COVID, 20 to 25 studies actively recruiting on a continuous basis. We have now about 10, so that got cut in about half. The researchers will often come to the Lunch and Learn events to recruit attendees and also share their work. So we have several different kinds of recruitment strategies, and you can see the retention strategies are so important. And one of our publications was on promoting retention, African American older adults in a research volunteer registry. Overall, our retention was over 80%. Only 6% actively dropped out. The others either passed away or we could not locate them. Takeaway messages: rather than emphasize deficits, we celebrate the opportunities to improve. We focus on a wide variety of health and aging topics. And recruitment and retention in diverse communities is high touch with multiple points of contact. Hope you have a great meeting, and thank you.
So that's Peter. I put some of the references he was talking about there. I guess I want to just make sure people understand sort of why we came today. And I guess it was sort of, a lot of people give lip service to community engaged research, have a community advisory board, et cetera. And I guess we wanted to share sort of, because ours is so long standing, sort of how we do it in Michigan. But I really wanted, when we were doing the ordering of the program, I really wanted Henry to speak next. And I would say, I point you to the 2 blue boxes that are in that slide, which is the older adult voice is often missing from research, and researchers must first learn to confront their own biases, slow down, and be willing to learn. And these are lessons that we get in different ways from our longest serving CAB member to Henry, which is one of our newer CAB members. And so we asked him, we gave him these 3 questions. He selected the questions, actually, I guess we'd say it that way. And so I'm just gonna let him take it away. He's an amazing resource for our community. I am so lucky to know Mr. Swift, and so I think you'll be delighted to hear from him. So I'm gonna mute myself and turn it over to Henry.
Thank you, Tam. Your check will be in the mail, okay? Again, my name is Henry Swift. I live in Lathrop Village, a suburb of Detroit. I am an 83-year-old Vietnam-era veteran. I've been married for 59 years to Lizette. We have owned a business supply company for now 33 years. However, we no longer actively manage it. I'm a graduate of Wayne State University, the home of the Gerontology Institute, of which I am now a member of the Community Advisory Board. As I experience the octogenarian phase of my life, I continually find myself grappling with the mental and physical changes associated with aging, like going upstairs for something and forgetting why I was there, or trying to dribble a basketball down the full length of the court without gasping for dear life at the end of it. I joined the Healthier Black Elder Centers Advisory Board for 3 reasons. 1, the opportunity to assist the Gerontology Institute in reviewing proposals on important research studies affecting seniors. 2, to gain an understanding of what happens clinically in the aging process and to learn about new advances and discoveries in this area. And 3, to remain active, productive, and contributory as I navigate this pivotal phase of my own life. As a board member, I am particularly concerned on why the reluctance of African American men to participate in research studies on health issues affecting them, such as diabetes, hypertension, dementia, cardiac issues. Is it A, psychological, dealing with life after work? What am I going to do now? Or B, what is the direct benefit of the research to me? As the population of us seniors and baby boomers grow, the need for such research is vital now and for the future. I myself have participated in 2 research studies and are about to start a 3rd. I feel I can contribute in some way to this effort. Now, as Tam indicated, I was presented with 3 questions on the impact that being a Community Advisory Board CAB member has had on me. Last month at a SAGE symposium that Tam had referred to, Thomas Concannon, who's a senior policy researcher for the RAM Corporation, stated that 83 billion with a B had been allocated for research studies by institutions and agencies, among them the Department of Defense, the Department of Agriculture. That is a stunning commitment and shows the vital importance of research studies. That I have a small part in reviewing research studies and offering my input is both inspiring and gratifying. Also, I have been privileged to participate in Healthier Black Elders Center's telephone outreach project to sheltered members due to COVID-19. Now, this initiative is an attempt to reassure and convey the center's concern for its members confined to homes, cut off from their church and friends. The calls inquired about the respondents' feelings of isolation, depression, and helplessness. The outreach provide warm connection, empathy, and understanding. The feedback was revealing. 1,100 calls have been made. Now, to me, this initiative has been truly inspiring and coincidentally was originally conceived because of the COVID pandemic. Now, the second question that was posed to me was, how has being involved in the CAB changed my life? I am realizing those expectations as a CAB member, as stated in my introduction, reviewing research proposals, gaining insights on aging, and being productive in my retirement. HBEC has shown me how to reach beyond myself, to explore how to inform the Black community, my peers, on health issues particularly affecting them. Examples, again, the telephone outreach to the sheltered in has broadened my life experience. Secondly, Black churches are the centerpiece of the community. To re-enlist them to convene a seniors forum on the 5 issues afflicting this age group, for example, high blood pressure, diabetes, heart disease, dementia, cancer, would be life-saving. Pastors would be most receptive to such invitations. Now, these are opportunities waiting to be realized and whose scope of realization for me are life-changing. Now, the third question, what would you like to see more of as a CAB member? Firstly, I'd like to see greater attendance by elder Black men in HBEC's Lunch and Learn seminars. Among my own friends, there has been a high number of husbands lost to diseases. Secondly, I'd like to see HBEC's program expanded to heavily Black populated regions beyond Detroit. My own municipality, for example, Lathrop Village, is 60% Black. Thirdly, I'd like to see consideration given to 2 initiatives when we do return to normalcy. The 2 most ignored medical afflictions among Black men are diabetes and prostate issues. I have lost several relatives and friends to these diseases. Again, Black churches have shown eagerness in partnering with HBEC in holding information sharing talks on these 2 vital subjects. Such forums have been held previously by the center. A personal initiative I've entertained is enlisting Black male elders to participate in a mentoring program to young Black men that highlights the benefits of good health regimen, guided by, of course, HBEC, ensuring a lifestyle they can carry into their own senior years. With that, I want to thank Robert for inviting me to describe the privilege of being a board member of the Healthier Black Elder Center. Thank you.
Henry, that was super. Thank you so much. I think we can go on to the next slides, which Vanessa's gonna give a few slides, and then I will finish up, and then we'll open it up for discussion. So Vanessa, I think Henry, you can mute, please. And Vanessa can give us some of this you've heard before, but we're trying to just situate it for everyone on the call.
Thank you. Thank you so much, Mr. Swift. So my name is Vanessa Roe. I'm the Community Outreach Specialist for the Healthier Black Elder Center. And like Tam said, I'm going to talk about these things. It's going to look familiar, but I'm going to talk about them in a different way and explain it as all of our strategies we use to do community outreach and to engage our community. So thank you so much for having us here. I'm really excited to spend this time with you. So to give you an idea of how our program is structured and the layers of our program, we created this graphic on the left-hand side that helps illustrate how we all piece together. So it starts on the bottom with the National Institute on Aging. And the NIA recognized many years ago that there was a lack of representation of older adults participating in research and a lack of representation of minority scientists conducting research. So in order to address these needs, they decided to create a funding mechanism and program to try and address this problem. So they created these resource centers for minority aging research, RCMAAR. And RCMAAR has a variety of centers that are located across the country. And each center focuses on a particular population or disease. So they have centers that focus on the Latinx population. They have centers that are AD focused, that focus on Alzheimer's and dementia. And if you go up one more layer, that's where our center comes from. So our centers in Michigan, we focus on African American older adults. And you can see in our logo to the right that it's actually 3 universities that have come together to coordinate the center. As Peter mentioned, historically, it was Wayne State and the University of Michigan. They have been running MCUAAR for many, many years. And in the last round of funding, we invited Michigan State University to join. So now it is the 3 universities working together. Within MCUAAR, we have different cores. And as Peter mentioned when he talked about the goals of MCUAAR, it follows that 2-pronged approach of increasing participation in research and increasing the mentoring of minority scientists. And Tam's going to talk more about the mentorship side of it, and I'm going to talk more about the research and community participation side. So our core is the community core, and we really are responsible for engaging with our community in Metro Detroit, and that's where the Healthier Black Elder Center is from. So at the very top, it shows the participant research pool. That's our research registry that lives within HBEC. That's our database. So when older adults join the program and become a member with us, they get added to our research registry. And I'm happy to take questions as I'm going through. So feel free to pop those in the chat or let me know. So this just shows our community core. So at the top, you can see Dr. Tam Perry, Dr. Jamie Mitchell, and Dr. Kent Key. They're the co-faculty leaders of our program. And each one represents each university that is part of MCUAAR. Each core within MCUAAR has representation of faculty members from each university. Then below it has myself and then my counterpart, Sean. So I work out of Wayne State University, which is located in Detroit, and Sean works out of Michigan State University, and he's based out of Flint. We have 2 part-time staff that work for us in the office. We have Miss Adelia Cooley and Miss Pat Mullen. Pat is also a board member, so she works part-time for us, and she's also one of our advisory board members. So I like to come back to the goal of our program because we print our goal on everything, on our newsletter, any forms and documents our advisory board uses or references, we put the goal there. At the start of every community engagement event, we share our goal. We always reflect back to our goal when we do any program planning, make any program decisions. It just helps us stay on target and make sure that we're continuing to meet the needs that was originally determined and developed by our advisory board. So everything starts with our advisory board members and is led by our advisory board members. So they decided that they wanted the goal of the Healthier Black Elder Center to focus on addressing and reducing health disparities through research and through education. So it's also this kind of two-prong approach. So the research side is our registry, the PRP, and the education side are these free community events that we put on. We invite older adults to attend, and we present health information. And again, the board members are involved in every part of this, but we choose a specific health-related topic. I bring speakers in to present. They share the health information, and it's a really great way for us to give back to the community and thank them for, you know, being a part of our program or even just considering to hear about our program. So I also want to mention that the name Healthier Black Elder Center was also determined by our advisory board. They didn't want to say healthy Black elders, they wanted it to say healthier, to be more inclusive, that anyone can get healthier, anyone can be healthier. You didn't have to start as healthy or whatever you define as healthy. They wanted it to be more open and inclusive. So we heard from Mr. Swift and his perspective of being a board member, and just to give you a little more nuts and bolts on our community advisory board, it's made up of 15 members, and they receive an annual stipend for being a board member. They have some requirements and responsibilities they have to follow to continue being a member on the board. So they have to be a member of the Healthier Black Elder Center. And our requirements for people to join the program is they are aged 55 or older and identify as African American. That's it. Those are the only inclusion criteria we have. So we have between 4 and 6 board meetings a year. And like I said, our board members, they contribute to planning our community outreach events, which we call Lunch and Learns. And they also contribute to planning our newsletter articles. So they determine what information we put in the newsletter. We ask them to attend at least 2 Lunch and Learns a year. And they really are the community ambassadors for the program. So they take information about the HB program and they share that within their own community networks. So whether it's, you know, within their friends, their family, their neighborhood, their churches, any other groups that they're involved in. And they also recruit people to join the program and become an HB member. And probably, you know, I mean, they've a lot of important roles, but one of the most important roles is they are the gatekeepers of research for our program. So they receive the applications researchers must submit to be reviewed, and ultimately they decide who is approved or denied to use our program to recruit for their studies. And I'll explain a little bit more about that. But this is most of our board members. And what I like to point out is our board members have varied backgrounds in careers, education, experience with research, even experience with academia in general. So I like to highlight that this is a huge strength for us. They bring such great perspectives, and they really take their role as a board member very seriously. So just to highlight some important things about our Lunch and Learn events. So this really is our main mechanism to connect to the community, to share information about our program, hopefully get new members to join the program, but ultimately it's a way for us to give back and just to thank them. So these events, I host them at recreation centers, senior centers, churches, as long as they are an accessible venue. All one floor. If it's multiple levels, they have to have working elevators, has to have good parking, and if possible, on main public transportation route. Every Lunch and Learn that we host always offers free health screening. So I will always invite some sort of home healthcare company or nursing staff, and they will come and do blood pressure screenings. Sometimes we've had someone that could do glucose screenings. We've had folks do memory screenings, frailty tests. I had some audiology students from Wayne State come and do hearing screenings. Again, we always start with an introduction of our program, who we are, what our goal is. And I always like to introduce board members that are attending, because I think it's important for members of our program to see who our board members are, what their function is, what their role is. And it's always nice to be able to put a face to a name and see that they're part of their community, they're their peers. It just helps maintain relationships and build trust. I also invite researchers to attend our Lunch and Learns, because it's a way for them to share what research studies they're running and recruiting for, and that's one way that our members can sign up to participate in the study. And we do evaluations. So we do evaluations because I want to hear from our members if the information they learned at the Lunch and Learn was relevant and meaningful to their life. If they learned something new, what would they change? And we ask for their input on future topics of interest that they would like us to do a Lunch and Learn on. And I compile the evaluation and data, and I bring that to the board members, and they use that as part of their decision-making process when we plan our next series of events. And we've done Lunch and Learns on so many topics. They've ranged from heart health to brain health, nutrition. We've done ones on hearing, vision. I had the Red Cross come and do one on fire safety. So they're always health related in some way, but tailored to meet the needs of the community that we're trying to serve. So they're always tailored to older adults, and trying to, again, make sure that the information we share is relevant and meaningful to them. Okay, let me make sure. Okay, so make sure I'm not missing any questions. So our newsletter is, I would say the Lunch and Learns is the top engagement strategy we have. Our newsletter is a very close second. Our members, they're older adults, they like print materials. They like something tangible that they can hold in their hand and reference at any time. So we mail a newsletter to all of our members twice a year. It includes information on what we're doing as a program, updates, but what I think is really important is we always highlight a research study that's currently recruiting from our program or just completed recruitment, and sharing the results. Our members want to know, we love participating in a study, but we want to hear what happened. Like, what's next? What did you find? So our newsletter is a great mechanism where we can bring those results back to the community. We always highlight one of our board members. And here you can see the MCUAAR scientists. So that's part of that mentorship program. We always highlight who our MCUAAR scientists are that are in that mentorship program, and sharing, you know, the research that they're conducting as well. So when it comes to our actual database of our PRP, again, we ask that they're at least 55 years or older, and that they're willing or considering to participate in research. When I say that we always share the goal of our program everywhere we go, whenever we interact with the community, we always share that research is always voluntary. So just because someone decides to join our program and become an HBE member, that does not mean they have to participate in research. And it's so important for us to always share that messaging with our members. We have some members that love participating in research, and they will participate in every study they get contacted for, and that's great. I have some that they only like participating in studies that sound interesting to them. And then there's some that are still warming up to the idea of research, but they love coming to the lunch and learns, and they love being engaged with the program that way. And that's great too. So we ask that researchers that want to use our database to recruit for their studies, they have to have prior IRB approval. And then this image on the right-hand side is a copy of the application form that researchers must complete. We have a replica of this form that our advisory board members use to review these applications. And it walks the board members through evaluating each component of the study. And at the end of the review, it asks if this study meets the needs and goals of the HB program. So that's another way we're always bringing it back. So we have multiple points of contact and engagement with our members. One of them is when they initially join the program, we do a survey with them. We re-survey with the same survey every 18 months. It's a way to stay connected, make sure we have updated health information for them, and the correct mailing address and contact information. I'm gonna go to this slide to show you the other ways that we stay. So we also mail a birthday card to all of our members. As we chat with our members, whether it's through resurvey or we see them in person at an event, if they mention that they recently lost a family or friend, or recent illnesses or hospitalizations, we also mail sympathy and get well cards. These 8 to 9 lunch and learn events throughout the year, the biannual newsletter, these are all ways that we stay connected with them, that we can continue their engagement with the program. So even though these things are listed as a retention strategy, it's also our outreach strategies and our engagement strategies. So they kind of double up that way. In terms of recruitment, I mean, you could even substitute recruitment for outreach as well. We attend different community events as a resource table. We partner a lot with community organizations, whether it's to host a lunch and learn at their venue, or inviting us to give a presentation on our program and inviting their members to join. We do a lot of community presentations. And again, our board members are really those important program ambassadors that share information about our program with their communities. So I'm gonna stop there and I'm gonna let Tam take over.
All right, I'll just say next slide, Vanessa, and I won't take so long so we can kind of open it up for discussion too. So I would say one thing I want to leave everyone with, especially since your kind of an institute on dementia and brain health, is that we also have those kind of institutes in Michigan. Ours is called the MADRC, which is the Michigan Alzheimer's Disease Research Center, I believe. And I would also say that one of the things, this woman in the picture is Dr. Edna Brown. She always said, before 2008, there were 3 African Americans in the first 25 years of the University of Michigan's Alzheimer's research studies. So that's a shocking number if you think about it. And so we are trying really hard in our state and with the big universities to make sure that there's sort of an Alzheimer's specific research registry. And I would say the Healthier Black Elders, our PRP of 1,300 members, kind of fluctuates. They also, because of their positive experiences with research, are open to other kinds of research. So I guess we're very proud that to date, 143 of our members have also gone into the Alzheimer's registry. And then there's a longitudinal one, this U of M map, 105 of them have been open to it. So the representation of minorities in Alzheimer's research, I feel like our work at HBEC is directly contributing to. Next slide. Oh, Vanessa, next slide. Oh, sorry. I guess I think we've seen this slide before, but I would say this. This is how we know your Professor Robert Turner, because I met him as one of the scientists who was being mentored. And so we are not only just proud of all the university professors that have gone on, but we're also especially proud of Robert and the great work he's doing at GW. And I would say these mentored relationships continue in, I'm now doing a grant proposal with Robert. People develop publishing careers during this process. So I would say we are so proud of our mentoring program. We choose 3 scientists a year and they get mentored monthly by a whole host of faculty who open up doors for them. So that's been very crucial to that side of the program. It's also very important when I talk to PRP members / CAB members. So every CAB member is also a member of our PRP. They say it's really great to open the newsletter and see people like them becoming university professors. So they note it and it's meaningful. Next slide, please. I think we'll skip over the logic model. It's very much in the article, but clearly I think we've already shown you how our logic model comes to life, and that's fine. We can answer any questions on that. Next slide. Next slide. We are definitely building the literature. We have a new one out in press. It's coming out in Ethnicity and Disease. I think it's already out, so look it up. Next. Okay, so these are I just have a few last slides. So I think it's really important for us to understand ideologically why the way we do our program is meaningful for the older adults in it. So instead of being both overlooked historically, as well as, and it's an interesting flip, it's also being actually harmed deeply by research, which we'll add to the slide next time. You know, people do not forget Tuskegee. People do not forget what they were brought up with to say, don't trust researchers. Researchers will take your information and run away with it. Instead of all that, we are offering these opportunities. We are also offering these opportunities for people to share their stories, to be a step closer to reducing both marginalization as well as being just left out of research. Next slide, please. And then I would say one of my big roles in MCUAAR is to work with the CAB members. So, you know, it was very interesting at the beginning of the pandemic. We were trying to do a special issue of the newsletter, and we said, let's have our CAB members do the articles. And so I said, Vanessa, I'll call every one of them. And I got people to write on different things, what they were doing in COVID, how they were surviving COVID, how to think about things. And it was so exciting that they were contributing to the production of the newsletter. The other thing is, I want to emphasize how much our CAB members contribute to research design. So they really go back to researchers and say, have you thought about this? I don't think this will work. They give feedback on the materials, like this flyer or this consent form is too confusing. This flyer people will not understand what they're supposed to do. The other thing is about the ethics of it. So they look at these studies and they think about, is this good for my community? Would older adults think this is valuable? Because I think CAB members also see their role as being the gatekeepers to the PRP, and they take it seriously. And so again, this is another step closer to democratizing research. And I would even say we're creating some best practices here. Next slide, please. And then this reviewing of proposals, when I got involved with it, I realized you can't ask people from all these backgrounds to review proposals if you don't give them capacity to do that. So every time we have a CAB member, I am actually taking some of my slides from my master's level research classes and just going over what are different purposes of research, what is validity, what is, all the researchy terms that we all know on the call. And I want them to understand that both more technical stuff in order to review proposals, but I also balance that with saying, but a researcher to gain access to our PRP needs to also be able to develop the skills to translate research to a way that people can understand it. Because if no one can understand it, there's no point in this. I would just say at the midterm election, we did an incredible lunch and learn program about senior voting that was directed by the CAB members' voices. Next slide, please. And I would just say this is on one of my last slides. In our community, we don't let the research or the researchers disappear. And so again, we are promoting diverse research dissemination approaches. Next slide. And I think this is the how. They come back. They come to the lunch and learns. The researchers come to the CAB meetings. We actually print their articles. We actually have a question to the researchers about what are you doing? You want to show that? Next slide. Oh, sorry, never mind. So I thought it was a screenshot of the question, but the questions are like, what are you doing to disseminate this research in the community, and what are you doing to contribute to policy from your research? The other thing that another CAB member, Joanne Smith, said to us once a few weeks ago, she said, when I can meet the researchers, I do. And it was just so profound to me that Joanne and other CAB members have no qualms about basically interrogating researchers as to what they're doing. And I think this is just only building trust. And I think this is probably the end of my presentation. So you've heard from Peter, Henry, Vanessa, and me. We're happy to answer questions.
Absolutely is. And I would like to say thank you very much for being here. I know that we'll be in contact later, but I'm going to turn it over to Melinda just to see if she has any parting words that she'd like to share.
I mean, really, I just want to thank Vanessa, Henry, Tam for a fabulous hour and a half. I think, as Robert mentioned, we're a bit deer in the headlights here. There's so much to kind of take in and process. And I'm really excited about what we can build here in DC, and I hope to learn a lot from you, now and perhaps in the future as well. Closing thoughts, again, if you are not currently affiliated with our institute, we are the GW Institute for Brain Health and Dementia. The easiest way to reach us is at the brainhealth@gw.edu email address. We're happy to engage with you, whether you're a student, you're a fellow, you're a postdoc, faculty member, researcher. We're always looking for new partners. So please do reach out, and we're happy to connect you to our meetings, to our other members, to build something great here at GW. Brittany, if you wouldn't mind just sticking the email in the chat one more time, as well as our website. We do have a functional website, although Google hasn't found it yet, so we're trying to fix that. But if you can get to it from the direct link, so we'll put that in the chat as well, just so if you want to know a little bit more about our institute, you could do that there. But again, really wanted to say thank you. Thank you, Vanessa. Thank you, Henry. Thank you, Tam. This has been really informative and such a lovely hour and a half of my day.
Super. On behalf of the whole team, thank you for inviting us. We were super excited to share our knowledge.
Awesome.